This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, well, here we are at the beginning of a new year. We're going to do the first of our monthly healthcare updates. Joining me, as often is the case, is Dr. Stuart Shapiro. He's the president and CEO of Pennsylvania Healthcare Association. Dr. Shapiro, welcome to the program.
Happy New Year, Terry.
Same to you. Well, we're going to have a big year in healthcare, and I don't think there's any issue that has moved more front and center. Of course, we have the Affordable Care Act, but we also have the expansion of Medicaid. And there are two ways that Pennsylvania conceivably could do it. One, and I'm going to let you talk about this, is the governor's plan, and the other is to do the more traditional Medicaid expansion. Do I got that right? Basically, they're the two plans. So why don't you talk first about the governor's plan, because I know that's the one that you've been focusing a good bit of your attention on.
As you know, I am nonpartisan or bipartisan. I talk only facts. I work with Democrats and I work with Republicans. And I've been working on national health insurance since 1973 when I was a chief aide to Senator Ted Kennedy. This is near and dear to my heart.
Okay.
As you say, there's two ways to do it. Traditional Medicaid expansion, which was proposed by the Obama administration, or the plan that Governor Corbett's taken. If you look at the differences, the governor's plan makes much, much more sense fiscally, socially, economically, quality of care wise, lets people maintain their physicians if they have them, which the Affordable Care Act undercuts. But most importantly, it doesn't expand Medicaid, which is a very, very broken system. Today in Pennsylvania, 1 of 4 Pennsylvanians is on Medicaid.
Sure. Are on Medicaid, 1 in 4.
1 in 4.
Okay.
Excuse me, 1 in 6. I apologize.
That's fine.
But if they would have expanded Medicaid the way the Affordable Care Act proposes, 1 in 4 would have been on it.
Okay.
Significant expansion. By using private insurance markets, the Corbett plan brings affordability, sustainability, quality, flexibility, and it all uses private markets. It maximizes government money. Under the Affordable Care Act and the way the Obama administration wanted Medicaid expansion, there was going to be support, significant support for the first couple of years. After that, it started to dwindle down. And what Governor Corbett has said is, I can't, as governor, pour billions of dollars into a broken system that's unsustainable. Yeah. And by the way, as you know, I'm bipartisan. Yeah. But Tom Corbett's right.
Just so to help our viewers out, here's what, tell me, Governor Corbett is saying he wants to take the subsidy that comes to the state and turn the subsidy, and it's based on a formula, poverty level and all of that, to individuals. They would then buy their own coverage on the insurance exchange. Is that correct? Is that what he's proposing?
And it would be and they'd be using federal dollars to pay for it.
Right.
He wouldn't be putting it into a terribly broken Medicaid system, which underpays people. And if he underpays the providers, whether they be doctors or hospitals or nursing homes, he also will allow, the governor had a very successful program called CHIP, which has been around now for 20 years.
Started by Governor Casey.
Started by Governor Casey, expanded by Governor Ridge, further expanded and reauthorized by Governor Corbett, and he wants to maintain that program. Obamacare in its standard form would have put all those individuals onto Medicaid. The other thing that the Corbett plan doesn't do is it doesn't pit limited Medicaid dollars, which are used for the elderly and for disabled to provide services at home and in nursing homes. It doesn't pit them against the new people coming onto Medicaid. So his plan makes sense today, and it will make even more sense tomorrow.
One of the more controversial features is the work requirement and whether HHS, and I want to point out, and why don't you can mention this in your response if you want, that this has to be approved by Health and Human Services, and there have been back and forth on that. Go ahead.
As you know, I'm bipartisan,
right,
or nonpartisan. So I'm not here to defend Governor Corbett's plan, but I do think it is the right plan. And it's too important because it's the plan on the table that our congressional delegation, all 18 members, support. And so far, it's been not a single Democrat has supported it. But it's right there, and the plan would bring 500,000 people onto the insurance system almost immediately, as soon as it gets approved by HHS. Now, that work requirement. HHS has not said no.
Right.
We know lots of people, at least I know lots of people who have been collecting unemployment compensation because they've been laid off. They have a work requirement. Seems to me that a work requirement to collect a federal subsidy or to get insurance paid for by the taxpayers is not unreasonable. It shouldn't become a political football, and that's why both Democrats and Republicans ought to sign up and support this. HHS ultimately could say no. It's only one feature of the plan.
Right.
But it does bring some responsibility to the issue, just like the plan promotes people to stop smoking, that they lead healthier lives. That's very important in today's market.
But they could also just say, we'll approve it if you drop that requirement.
They absolutely could.
Regardless of whether it's right, the requirement's good or bad.
They absolutely could. I happen to see an article
similar to the Arkansas plan that they approved for Arkansas. Go ahead.
It's almost identical to the Arkansas plan. But they could say no to this. But again, my view is that the congressional delegation, Democrats and Republicans, ought to try to fix this, not nix this, because it's too important to begin to bring health care to Pennsylvanians now and not wait a year or two further, which would be what would happen if this were turned down.
Yeah. We only have about a minute and a half left, but there's a bill in the legislature that deals with admission status during hospital treatment that you have an interest in, and it has to do with what hospitals would require. Just give us a thumbnail
Again,
on that
it's my role as an advocate for the elderly. Right now, if an elderly person goes into a hospital emergency room, and then they go upstairs to a room and they're there, they don't know whether they're really admitted to the hospital or what technically in what's called observation status. It's very important. All this bill does is require that the hospital tell them what their status is. Because if they're in admissions, then when they go for rehabilitation after they get discharged from the hospital, then it's covered. But if they're on observation stay and they stay, they have to stay 3 days. But if they're in observation status, this doesn't get paid for, and they could be held accountable for tens of thousands of dollars of bills. This is a bill supported by AARP. It's a consumer piece of legislation. Again, it's our role as advocates for the elderly.
Well, we're going to obviously follow particularly the debate over the Medicaid expansion, which is, as you know, a pretty big issue, and we'll have you back, obviously, as we move along here. All right, I want to thank you, first of all, for being on the program, and I want to thank you for watching, and as always, you stay well.